mynews.studio.
A single drop of blood could soon reveal whether someone is at risk for Alzheimer's years before any symptoms show up. What does this mean for families and for medicine as a whole?
Today is June 9th, 2025. The FDA just cleared the first blood test for Alzheimer's diagnosis in the United States. That's a major shift. But how transformative is this, really?
It's a big step. For decades, spotting Alzheimer's early has been a challenge. Until now, doctors have mostly relied on PET scans, which are expensive and not available everywhere, or lumbar punctures, which are invasive. This new blood test, called the Lumipulse G p-tau217 and beta-amyloid 142 plasma ratio test, only needs a simple blood sample. It measures two proteins, p-tau217 and beta-amyloid 142.
Those proteins, are they the same ones that form amyloid plaques in the brain? The ones linked to Alzheimer's?
Yes, that's right. The test checks for abnormal levels of these proteins. If they're elevated, it suggests that amyloid plaques are present in the brain, sometimes even before any symptoms appear. That means doctors could intervene earlier. Recent studies show these blood tests are nearly as accurate as PET scans at predicting Alzheimer's pathology.
If this is so accurate, why haven't we used blood tests before? Has the science changed that much?
Exactly. The technology just wasn't there. Early blood tests weren't sensitive enough to pick up these tiny changes. Only in the last few years have researchers developed assays sensitive enough to spot disease signals this early. And it's not just about diagnosis. Some new tests, like those measuring MTBR tau243, can even help stage the disease and show how quickly it's progressing.
So, these tests don't just say yes or no. They can track how Alzheimer's changes over time?
Exactly. That's important for treatment. The FDA has approved new Alzheimer's drugs that slow disease progression by lowering amyloid levels. But these drugs are most effective early on. Early, accurate diagnosis lets people start treatment sooner, plan care, and support families.
Does this have an impact on clinical trials too? If you can spot people earlier, can you speed up research?
Yes, it's already happening. The USC Schaeffer Center is using these blood tests to recruit trial participants faster and more accurately. That could mean quicker development of new drugs and therapies. And in the UK, there's a big trial, the Blood Biomarker Challenge, aiming to make these blood tests routine within 5 years.
But what about access? If the tests cost about $200 each, is that realistic for everyone, especially in lower-income countries?
That's still a real challenge. Many countries lack the lab infrastructure needed for these tests. And while $200 might be manageable in some places, it's simply out of reach in others. Until costs drop and the technology spreads, access is going to stay limited.
Besides money and science, there are ethical questions too. What happens if someone learns they're at risk for dementia, even before there's a cure? And what about privacy?
Those are big concerns. Widespread screening could cause anxiety, especially if there's not enough support in place. Then there's privacy. Who gets to see your health data? How do we make sure people's psychological well-being is protected? As these tests become more common, we need clear ethical guidelines to balance early detection with personal rights.
For patients and families, what does this mean in practice? There are 1 million people with dementia in the UK alone, and millions more worldwide.
For the third of people who go undiagnosed, this could mean earlier access to care, support, and treatments. For families, more time to prepare and make decisions. The hope isn't just a longer life, but a better quality of life too.
So we might be looking at a future where a routine blood test catches dementia sooner, helps tailor treatments, maybe even slows the disease. If, and it's a big if, access and ethical challenges are solved.
That's the hope. We're close to a new era, but there's still a lot to do to make sure these benefits reach everyone, not just a few.
For anyone listening, it's worth watching how these tests roll out. Will they truly change dementia care worldwide, or bring new challenges we haven't seen yet?
We'll keep following this story as it develops. Thanks for joining us as we break down what these blood tests might mean for dementia care in the future.
Thanks for listening. This episode was brought to you by mynews.studio. Give it a try for free.